Cranberry is a good source of anthocyanins, and it's well known for its usefulness against urinary tract infections, but it's also demonstrated anti-Helicobacter pylori properties in preclinical, animal and clinical models. In a randomized controlled trial in a population at high risk for stomach cancer, 90 days of twice-daily consumption of cranberry juice was more effective than a placebo at suppressing Helicobacter pylori infection. In another randomized control trial, the addition of cranberry juice to triple therapy markedly improved the rate of Helicobacter pylori eradication in women. In preclinical research, cranberry extract inhibited the growth and the proliferation of Helicobacter pylori. This action was attributed to its polyphenol components. A compound from cranberry has been shown to prevent Helicobacter pylori from attaching to the stomach lining cells and to the mucus. Glutamine is the most abundant amino acid in the body. It's a major metabolic fuel for cells of the intestinal lining and the immune cells. Preclinical animal and human studies have shown glutamine supplements can help to repair the intestinal lining. Glutamine supplements might be beneficial in preventing injury due to Helicobacter pylori infection. In a study in mice who were infected with Helicobacter pylori, supplemental dietary glutamine protected the stomach mucosa by modulating the immune response to the Helicobacter pylori and reducing inflammation. In another study, long-term supplementation with glutamine prevented cancerous changes in gastric mucosa of Helicobacter pylori infected gerbils. In multiple trials, vitamin C deficiency has been associated with peptic ulcer disease, gastritis, Helicobacter pylori infection, and bleeding from peptic ulcers. At least one author has proposed that vitamin C might help to prevent reinfection in those who have been treated for Helicobacter pylori, based on experimental evidence that the vitamin C inhibits the growth and the colonization of the Helicobacter pylori. In a randomized control trial, the addition of oral vitamin C 500 mg per day to bismuth quadruple therapy was compared with the same quadruple therapy alone. The addition of the vitamin C resulted in significantly higher Helicobacter pylori eradication rate, from 49% up to 78% with the vitamin C. In a randomized clinical trial in patients with Helicobacter pylori infection and chronic gastritis, high-dose vitamin C treatment, 5 grams per day for 4 weeks, resulted in Helicobacter pylori eradication in 30% of the patients. Magnesium salts are common ingredients in antacid formulations, but magnesium also appears to possess important anti-ulcer properties. In one animal study, rats were pre-treated with magnesium before the administration of a non-steroidal anti-inflammatory drug to induce ulcers. Compared to an untreated control group, the magnesium-treated rats had significantly reduced ulcer formation. The anti-ulcer effects of magnesium were attributed to its ability to decrease the number of acid-secreting cells and to increase the number of mucus-producing cells in the stomach. In animal studies, whey and whey protein-derived compounds have demonstrated ulcer protective properties. These effects of whey protein might be related to its role in raising the levels of glutathione, which shields the mucosal lining from free radical damage. Whey protein contains high levels of sulfur-containing amino acids, like cysteine, which is utilized in the synthesis of glutathione, a powerful scavenger of free radicals. Increased mucus production and lower plasma gastrin, an acid-stimulating hormone, might also help to explain whey protein's mucosal protection. The prevalence of duodenal ulcers is higher in countries where the diet is based on refined plant foods, such as milled rice and wheat. Conversely, the duodenal ulcer rate is lower in countries where staple foods consist of unrefined wheat, corn, soy, millet, and legumes. Experimental studies have demonstrated that the lipid portion of the whole unrefined foods, e.g. the oil from wheat germ or bran, protects the stomach and the duodenal mucosa by increasing gastric mucus production and forming a protective barrier against stomach acid. Within the lipid portion, phospholipids have been identified as active components. In a clinical trial, 204 subjects between 50 and 74 years of age were given either aspirin or the same dose of aspirin complexed with phosphatidylcholine. Those who received the phosphatidylcholine aspirin had less evidence of gastric and duodenal mucosal damage and ulcers when compared to those receiving the aspirin alone. Animal studies suggest the phospholipids protect against the damaging effects of other non-steroidal anti-inflammatory drugs. Aloe vera extract has been shown to have healing and anti-inflammatory effects for skin damage, burns, pains, and edema. Preclinical and animal studies have found aloe vera also has gastroprotective and anti-ulcer properties. In an early trial in 12 patients who were diagnosed with peptic ulcer disease, the administration of a tablespoon of aloe vera gel emulsion daily led to a complete recovery. Results from animal studies indicate aloe vera inhibits the secretion of stomach acid, it reduces gastric mucosal inflammation, and it enhances stomach ulcer healing. In a lab study, the inner gel of aloe vera inhibited the growth of Helicobacter pylori bacteria, including antibiotic-resistant strains. For more information on herbs, supplements, or natural treatment plans, check out my website.